Well, if you're just joining us, this is Doug Shadel, State Director for AARP Washington, and I want to welcome you to this important discussion about coronavirus. We're talking with Seattle Mayor Jenny Durkan, local experts, and taking your questions live. We will focus on factual information in order to ensure that you are up to date and informed to keep you and your family healthy and safe. As we proceed, I will be mentioning a couple of websites you can turn to with a lot of great up-to-date content on the coronavirus. One is our website, and that address is www.aarp.org/coronavirus. AARP is convening this Tele-Town hall to supply information about coronavirus in an effort to help protect the public. While we see an important role for AARP to play in providing consumer information and advocacy relating to the virus, the public should be aware that the best source of health and medical information is the Centers for Disease Control and Prevention, the CDC. It can be reached at cdc.gov/coronavirus. We will also have information on our website about local information you can receive from the state and county government. But we are fortunate today to have four guests with us: Seattle Mayor Jenny Durkan, Patty Hayes, Director of Public Health for Seattle and King County, Cathy Knight, Division Director of Aging and Disability Services for the City of Seattle, and Ingrid Ulrey, Policy Director for Public Health for Seattle and King County. And first, I'd just like to welcome Seattle Mayor Jenny Durkan to talk a little bit about Seattle's response to the COVID-19 outbreak and resources the city has put in place to help residents weather the storm. Thank you, Mayor Durkan, for taking time out of what I'm sure is a very hectic schedule these days to speak with our members.
Thank you, Doug, for having me. And I think it's so important that AARP and you are doing these types of forums, because we know the more information people have, the better they can protect themselves. This has been just an enormously displacing event. No one has seen anything like this in their lifetimes, and it came upon us so quickly and at such a scale. We know that it's been really disorienting for many people. First, I have to say is we're fortunate in Seattle that, I would have liked not to have gone first on this, frankly, but since we did, we're really fortunate to have such a strong community of first responders, healthcare workers, public health workers, and a scientific community, because once we did see the virus come into our community, we were able to see very quickly that its true scale was much greater than we anticipated. And having that information, our government leaders, Governor Inslee, Jeff Duchin, who is the head of our public health, Dow Constantine, myself, and other mayors and executives could really talk and decide how we could take some quick actions to try to flatten the spread of the virus. We know that the things we have to do to fight this virus go against who we are as human beings. Physical distancing, isolation, all of those things are very hard. And I think for members of AARP and older people in Seattle, we are on the front lines. We know, number one, we're the most vulnerable to this virus, both because of our age and if we have any kind of underlying health conditions. Two, a number of older adults already struggle with not just health issues, but isolation issues and the ability to have mobility and see people. And so having to separate people one from the other, to cut off visits to any of our senior facilities, to do all those things we know has been very, very hard on people. And we know it's had a huge economic impact in the city as well. So many people have lost their jobs and small businesses have closed. We had to stop our senior programs because we knew we couldn't gather together. And when that happened, we had to find a way to distribute food to people. So we've been working really hard together, the city and the county and the state, to see how do we protect the most vulnerable, both on the healthcare front, but also on the economic and social front. So at the city, and I know the county's been doing this too, to change our programming to try to get, for example, meals to the people who are most vulnerable, to make sure that people living in congregate facilities, whether they're homeless facilities or aging facilities, to make sure that we can do what we need to do to keep people safe, which is very difficult because of how this virus spreads. And then converting as many of our programs to be ones that get money into people's pockets. I couldn't be more proud of the people in the city as I am. I have seen how hard people are working around the clock to try to help people so that we could have a grocery voucher program to actually get $800 into the hands of thousands of Seattle families that otherwise wouldn't be able to buy groceries, to try to get loans to small businesses, and to work with people like Patty Hayes and public health at the Department of Health at the state level to make sure everybody had the same true information about what we could do to stop this virus. I know there's been a lot of press out there. I'm going to close with this. There's been some press about how we've had successes because we worked and started so fast and people have done what we've asked them to do, but we are not out of the woods. Even though it looks like we are flattening the curve, if we come together again, this virus is voracious and it can take off again. And so we have to keep doing what we're doing for a period of time and really urge people, you can't gather, you've got to stay home. If you have to go out in public, make sure you wear a face covering, keep your distance from other people, 6 feet. These are the only ways we have to stop this virus right now because we don't have vaccines, we don't have a cure. The cure is how we help each other, and that's what I think is going to get us through this. So I look forward to talking to the people on the phone.
Excellent. Thank you, Mayor Durkan. And if you're just joining us, that was Seattle Mayor Jenny Durkan. My name is Doug Shadel, State Director of AARP Washington, and you're listening to a town hall meeting where we have local experts answering your questions. If you'd like to ask the mayor a question or any of our experts, you can just simply press *3 on your telephone keypad now, and we already have quite a few people who've done that. Press *3 on your telephone keypad, and you'll be connected to a staff person who can take your question. Well, next let's hear from Patty Hayes, Director of the Public Health for Seattle and King County, who will talk about important updates and information available for Seattle residents. Thank you for being here, Director Hayes.
Thank you so much, Doug, and I so appreciate the invitation and opportunity to talk with AARP members across the state. I want to share with you about the virus and about our outbreak. Mayor Durkan gave a great overview about where we've come here. But as a Director of Public Health, of course, my role is looking at the health of all of our residents and population across the lifespan. As some of you may know or may not, I'm a nurse by background, and with many years of experience running community clinics and advocating for health care for all, I'm deeply concerned about the implications and the effects of what we have had to do and as the mayor said, this voracious virus. There are three key things that I want to say that's unique about the virus, just to make sure everybody on the phone knows why this is so different and what is different about a pandemic, which we have not had in the last 100 years. So first of all, the virus is called a novel virus. That's because it's new, which means individuals in the community, we do not have immunity towards this virus. And as we've seen in other areas of the country, it can be overwhelming to the community and to the healthcare system. And thus, as Mayor Durkan said, we moved very quickly with our health officer who works for me, Dr. Jeff Duchin, to address and give guidance as quickly as possible. The second thing is that right now there is no treatment specific for coronavirus. There are things on the internet now offering some ideas. Some of those may be valid and some not, but the science to develop a treatment has started internationally but is in process. So we need to make sure that we're preventing this as much as possible. And for those that do get the coronavirus, 80% of those folks will have mild to moderate symptoms. But folks who are with compromised immune systems, folks over 60, folks with underlying chronic conditions are most vulnerable, and we're seeing that the virus is particularly hard and deadly for those folks. And finally, we don't have a vaccine yet. There's a lot of work towards trying to get a vaccine, and I will be so grateful when there is a vaccine for this, as we've seen, so that we can deal with this as we do with other communicable diseases. So as the mayor said, our physical distancing and the tools we've done with the community mitigation have been the strongest ways to head off this virus. And part of the goal of that is so that our healthcare system is not overwhelmed, so that when you need healthcare or if you have a problem, healthcare will be there for you and won't be overwhelmed and blocking care for other conditions because of being overwhelmed with coronavirus. And the state of Washington is doing a really good job. King County, it does appear, as the mayor said, that we are bending the curve. But when you bend the curve, it means that it extends it out. And thus the recommendation that we're looking at is how do we look at that over time so that we can bring back and reduce some of the community mitigations that we've done. I understand the steps that we're asking you to take every day is so grueling and so hard. Staying home, canceling visits with friends and family, denying yourselves everyday activities like exercise classes, visits to the library that are so important to all of us. It's so hard. And it's also of grave concern to me about, as we look at this over time, this isolation we know has health impacts. And I think about this so much, particularly for as a person that is over 65 myself, the isolation and not being able to do things that we normally do, and particularly if you have underlying health conditions and can't really get out, that takes a toll on not just our mental health, but on our physical health. And so public health is going to be watching this very closely, and I want everyone to hear that we really understand that the long-term negative consequences of isolation are real, and that we need to spin that into our conversations around how to keep this virus tamped down. We are seeing other areas around the country, not around our country, but around the world, where the second surge, I'll call it, of coronavirus appears to be starting. And what we do know with big outbreaks is that if you stop your mitigation strategies too soon, the second surge, it can be larger than the first one. And so we want to make sure that King County does not have that. So that's all being looked at by some of the most brilliant minds in the world and at places like the University of Washington and modelers who we are in contact with on a daily basis to try and help us figure this out. So I'm here today to talk with you about how you can stay safe and take smart steps that are important not only for you but for everyone around you. We can do this, and we can help each other, and it's only through supporting our entire community that we can make it through to what will become the other side. So I look forward to your questions. I'm delighted that my policy director, Ingrid Ulrey, is on the phone. Her expertise in this area, she will be with you as I'm going to have to jump off in a few minutes, but that's why I'm so grateful she's on the phone. So back to you, Doug.
Well, thank you, Director Hayes. If you're just joining us, that is Patty Hayes, the Director of King County Public Health, and we earlier heard from Mayor Jenny Durkan, and both of them have agreed to stay on the line for a little while, perhaps not the whole call, because they're obviously, as you can imagine, very busy. If you'd like to ask the Mayor or Director Hayes a question, or any of our guests, you can press *3 on your telephone keypad now, and you'll be connected with an AARP staff person. This is a Tele-Town hall conversation about the coronavirus, and I think we've got a lot of people on the phone waiting to ask questions. So let's go to the phones now. Let's hear from Diana in Seattle.
Well, of course, I am concerned about how this will continue, and the fact of not being able to be with friends or relatives in a closer manner. Is there any possibility of making some special ideas, giving special ideas as to how to keep these connections that are so important, especially to older people, and yet not face negative results for our health. Is there something that one can organize in a way that will keep people separate but also together in a certain way that does not involve the physical togetherness, which, as we have learned, is not good for one's health. It would be nice to know if someone could come up with that. Thank you.
Thank you for that question. Mayor Durkan?
This is Jenny Durkan. I'll take a shot at some of it. First, that is such a great question, and you are not alone. I hear that a lot. One of the questions we get, and so we at the city are trying to do a number of things. First is background. You're right. We don't know how long this is going on, but I want to echo what Patty says. We're going to be in this for some time, and the worst thing we could do is to try to lift restrictions too soon and get even a worse outbreak and be right back where we were. So we're trying to really say it's a marathon, not a sprint, but in the meantime, finding ways to have those connections. So at the city, for example, we're going to try to start a program working with the library and other folks to have some online things where artists perform, or there's readings, or there's connections. We're also trying to find ways to overcome some of the equity issues that presents, because not everyone has access to the internet and online in the same way. So different ways that people can come together. We've talked to some of the tech companies to see if there's ways to deliver more hotspots or other ways that people can communicate with one another. I know that people I know have been having, family uses FaceTime lots more on their iPhone, or they have virtual happy hours and virtual book groups. So I think we're going to have to get very creative, and we're, as a city and county and state, going to have to really try to get over some of those thresholds, because this virus has really shown us where the inequities are. First, it is the people who have the lowest wage jobs and the small businesses who got hit first, and it's the seniors who already have a lot of challenges, whether it's a fixed paycheck or isolation or hard connecting with people. So we're working really hard, but I would urge everybody to find new and different ways to communicate with the people they love, because we're going to be in this for a while, but we will try to find ways for us to keep doing things as a community, similar to these town halls, which is just another way, and I want to thank Doug and AARP for that.
Great. Thank you, Mayor Durkan. I want to take a question that came in on Facebook. This is from Carol. What is being done to protect the health and well-being of essential workers and their families? How can we help? And I take it by essential workers, they mean the people who have to go to their jobs, the safety professionals, people in hospitals, physicians, so forth. Either one of you want to take a stab at that?
Sure. This is Patty. So essential workers, particularly first responders, the frontline healthcare workers, those that are working in the long-term care arena, we are working with all of them and the folks that help staff those to look at what the needs are. We have health and hygiene recommendations. We have infection control experts that have been consulting. We are looking at how to get more personal protective gear for those essential workers. That has been in short supply around the country. The mayor and her staff have been awesome in working with us to try and figure out and put pressure to get more of the personal protective gear out to Washington State. And the Centers for Disease Control has been looking at what level of personal protective gear needs to be used in what kind of setting so that we can more effectively use what we have. So all of those things have been just pushed really quickly through in the last 3 weeks. we are working with employers and unions to give guidance, and as we move forward with this and as we learn more about the virus, we will be adjusting our tactics and getting information out. We have guidance on our website. So there's never enough time in the day to do enough that we need to do, but protecting essential workers is a really top priority.
Okay. Thank you for that answer. Mayor Durkan, anything to add?
No, I would just echo what Patty said, and like everything, it's evolved. We just announced yesterday that, for example, the city of Seattle has paused all of its public work construction contracts so that we could make sure that we have consistent on-site safety procedures for every worker, and we're trying to do that across sectors because we know that people that have to come to work so that we all get what we need have to be protected.
Yeah, great. Let's go to the phones again. Phoebe in Wedgwood.
Hi. I'm curious to know what the preconditions are for getting tested and where one would go for getting tested.
So this is Patty again. So right now, around our country, there has been a shortage of what's called test kits. For public health, we would want large-scale testing to be happening. But because of the shortage, right now we're prioritizing frontline healthcare workers and folks that are showing symptoms. So the best thing to do is if you are showing symptoms that sound or feel like COVID-related, which could be a fever, difficulty breathing, and you should call your healthcare provider. Your healthcare provider is your point of contact for testing. They can make the decision if you meet the criteria. The criteria is established through the Center for Disease Control and the State Department of Health, and then locally we work with all providers. If you're living in a assisted living facility or one of the facilities where a case of COVID comes up, you'll see that there's guidance for that living situation on how they need to change practices to protect folks. So in the future, we're hoping, just this week we got notified that we were going to get an influx of tests, and we hope that the pipeline for testing will be loosening up here so that we can see better where the virus is moving around in our community, which is called surveillance in public health language. But right now we're limiting that to folks that are showing symptoms. So again, if you have those symptoms, call your healthcare provider. If for some reason you don't have a healthcare provider, you can call one of the COVID hotlines and we can get you in touch with one of the community health centers. We don't recommend that you call 911, and we don't recommend that you call an emergency room or go to an emergency room unless it's actually an emergency.
Very good. If you're just joining us, this is a Tele-Town hall on the coronavirus, and that was King County Health Director Patty Hayes, and we have also had Mayor Jenny Durkan on the line, and in a couple minutes I'll be introducing Cathy and Ingrid Ulrey, also public health officials. If you'd like to ask our guests a question, all you have to do is press *3 on your telephone keypad now. I'm almost hesitant to say that because we have so many people calling, but by all means call in. We're going to try and get to everybody if we can here. Let's go back to the phones now. Shannon.
Yes.
Go ahead. Do you have a question?
Yeah, I just had a question. I'm a caretaker of my father. He lives in the home with me, and he has underlying, health problems. He has fallen probably about 5 times in the past week. But I'm scared to take him out of the house even just to see a doctor. I'm just trying to figure out, how can I get him tested to make sure that I have not brought, or my husband has brought in, the virus to him. And what are my options? I don't want to call 911. I don't want to, busy up the emergency rooms and stuff like that. I'm just trying to figure out what are my choices. What do I do? I work for the city of Seattle, and I'm feeling like I'm failing at this point. My dad.
That's a very good point. We're getting a lot of questions in the queue about this whole caregiver situation. Anyone want to take that? Thank you for that question.
Absolutely. Thank you. And my heart goes out to your situation. We hear from folks every day. And first, caretaking our parents is such an important role. So thank you for that. So I think one thing is if it's an emergency, you need to call 911. And our first responders are just fantastic. They've been working diligently and are there for you if it's an emergency. I know how hard it is when there are falls and you're trying to assess. So I think you need to keep in close contact with your physician's office, with his physician's office about his status. Many of them have moved to have actually telehealth consultations where you can actually talk to the doctor. Those that don't often have nurse call lines so that you can get somebody to reassure you and talk through what you're seeing. If your father is not having symptoms right now, very good. And you need to protect since you're the caregiver, you need to protect yourself when you're going out. You need to be wearing a mask. When you go shopping, I would recommend that you keep that physical distance from people. There is guidance about using Clorox wipes, etc., to clean when you get home from the grocery store so that you know you're not bringing anything in. The media outlets have actually been doing some good just visual spots on that, and there's information on websites for you. So the more you take care of yourself so that you're protecting yourself, the more you're protecting your dad, because we know that you need to you might consider having grocery drop-off. There's more and more of that so that you can concentrate on that. As far as testing your dad, if he's non-symptomatic right now and you're not symptomatic, the test would be good for the day it's done. So because we don't have ongoing broad testing over time for people, that's probably, I know this is going to sound strange, but it's probably not necessary if you're not showing any symptoms and if he isn't. So when you're working with him and you can keep a mask on yourself, that might be hard in terms of talking with him, but he needs to understand that everything you do to protect yourself, you're protecting him. So those are the recommendations that I would make. I'm sure I'm forgetting something, but I think the more you can look at how to protect yourself and then watch for symptoms that I've talked about again, cough, fever. You can watch yourself for those things. You can take your temperature every day. And for him, any cough or fever or shortness of breath would immediately, with his age, probably need to call the doctor immediately. And if there is respiratory distress, call 911.
Okay, thank you for that. I want
Hey,
to.
Doug, can I add? This is Jenny Durkan. Can I add just
absolutely.
one thing?
Yes.
To your caller?
Yes.
Please don't think of yourself as a failure. What you're doing is really remarkable, and we know it's also really scary for everybody. So nobody's got the perfect answers to these, and it sounds like you're doing the right things. You're asking the right questions. You're careful about what you bring home. You're taking care of your dad. So nobody should feel like they're a failure through this. We can only do what we can do, and we all appreciate what you're doing for your dad.
Great, thank you. Patty, are you going to have to sign off? I want to introduce our other guest, but feel free to stay on as long as you can, or if you need to sign off, I really appreciate your being on this call. And Mayor Durkan, likewise, if you need to. Are you guys okay for a couple more minutes? Or?
Yeah, I'll be on for a few more minutes,
5.
but then I might drop off without saying goodbye, if that's okay.
Yeah. Thank you just in advance of that, thank you for your time on this and all of your leadership, both of you, on this issue in this very difficult time. I really appreciate you helping us out and inform our AARP members. Let me introduce Cathy Knight, the Division Director of Aging and Disability Services for the City of Seattle. Cathy, whom we know very well, have worked with for years, is here in the Seattle area. Thank you for being here. Would you like to provide some overview comments, Cathy?
Thank you so much, Doug. It's really an honor to be on this call with you and Mayor Durkan, Public Health Director Patty Hayes, and my colleague Ingrid. I would love to tell you a little bit about Aging and Disability Services. It's a division within the City of Seattle Human Services Department. We call it ADS for short. And I just have to make a comment, too. I really want to acknowledge the great leadership and support we've had from the mayor that she's provided to all city employees. It's made a tremendous difference for all of us during this difficult time. So ADS focuses on older people and adults with disabilities. Our primary service population falls squarely within the high-risk category for COVID-19. That's folks 60 and older, people with chronic conditions that you mentioned earlier, folks with compromised immune systems. So I thought I'd focus on a couple questions that we hear over and over at ADS. How are we addressing the needs of older people during the pandemic, and who can I call for services and resources for older individuals? So to give you a little context before I get into those questions, so ADS has served a couple roles for like 45 years now. We've been a division within the city. We're also the Area Agency on Aging, or the AAA for short, that serves all of King County. And area agencies on aging were established under the Older Americans Act, and we receive federal funding to plan for and provide a range of options that are designed to help older adults age with dignity in their homes and communities. We're one of 13 in the state of Washington. There's over 600 nationwide. We all coordinate services now for older adults, adults with disabilities, family caregivers. So at ADS, we serve probably more than 46,000 people every year through our community meals, home-delivered meals, caregiver support and respite, kinship care, information assistance, and through our Medicaid case management service that helps people stay at home even if they're eligible for nursing home care. So right now, maintaining services for our existing clients and providing information and assistance for anyone with an aging or disability issue, those are high priorities for us. We're really thankful for the strong partnership we have with public health. We trust and depend upon their guidance to keep us healthy during the crisis. They're a formal partner for us as part of the Area Agency on Aging. So when COVID-19 hit the Kirkland nursing home, we began meeting regularly with public health and other aging network advocates, forming an older adults task force. This group continues to meet regularly and troubleshoots new ideas and challenges as they arise. We've also focused a great deal of attention on the approximate 12,000 individuals that we do support at home through our Medicaid contract with the state. So as I said, these are people who are eligible for nursing home care. They're low income, but they want to stay home and use in-home services, and many have complex needs. So right now, our case managers are just scrambling to check in with these individuals to ensure their safety, to maintain continuity of care for them as much as possible. We're concerned about the caregivers that do come in to the home. We're really struggling to find adequate protective equipment for the workers. These are just critical issues for those folks right now. So as part of the Aging Network, we're largely sort of unseen by the public, but it does allow us to keep track of how a lot of older folks are doing during this time. In terms of answering the question about who to contact if you need assistance, I want to mention one of our core services, and that's called Community Living Connections. It's our front door to most of our services. Anyone with a question about aging or disability issue can call for professional, confidential information and referral. It's free of charge. This is a service that every area agency on aging around the country provides in some fashion. So we're part of an extensive network. We kind of think there's no wrong door to getting access to this information. Now, during the crisis, our Community Living Connections network has fielded lots of calls a lot about food, rental assistance, medical transportation, prescriptions, and more. And as the mayor mentioned, there's a lot of work going on at the city to address the food access issues. Those remain big issues for us. We have community meals that are provided throughout the county. We had 58 sites when they were open, and of course now those are closed. So we have to continue to try to figure out how to provide for those needs. We have 35 community meal providers who are now delivering sack lunches and food boxes. We also offer home delivered meals through our Meals on Wheels program. We look at this as also an opportunity to maybe do a quick wellness check on folks, even if it's just standing at the front door. So there's a lot of different ways that we're trying to support people. The whole discussion about social isolation and the challenges, we recognize that so many of our members and even on our advisory council, we're recognizing that is a big issue, and we have some tips that we provide to folks, and I can make that available later. I want to make sure people know that we have a toll-free number for our King County Community Living Connections line. It's 844-348-5464. You can also visit us at the website communitylivingconnections.org. And there's also a state number if you're in another county, and a national elder care locator number. So I think I'll stop there and turn it back to you, Doug.
Okay, thank you, Cathy. We're going to introduce Ingrid Ulrey also in a moment. I just want to take a couple calls because we've got a lot of people waiting, but thank you for that overview of the City of Seattle Aging and Disability Services. Let's go to Kat. You're on the line.
Yes, hi. Great. I would like, it was like April 1st or 2nd that Mayor Durkan was on CNN saying that there were, quote, dozens, end quote, of senior living facilities in and around the Seattle region that had not been top to bottom tested. Top to bottom means not just, yes, there are a couple positive COVID results, but the point is we want to avoid situations where many, many people get infected, and nursing homes are just breeding grounds. And nursing homes, assisted living facilities where people must live in close proximity, but it's very easy for them to get infected. Why have all the nursing homes, assisted living facilities, independent senior communities, etc., have they been tested in Seattle and the region? If not, why not? Specifically since Bill and Melinda Gates Foundation, according to news reports, gave Seattle King County Public Health, as well as several Seattle foundations, a couple $1 million at the minimum, I believe, for the COVID disaster. Where has that money gone? Why hasn't it gone specifically into testing, and specifically of these facilities, which, as we all know by numerous news reports internationally broadcast, can lead to a lot of death?
So this is Patty. I'm still on the line. I can start. So your question is about testing and what we're doing in the long-term care facilities, which is very, very important. And the mayor and I talk about that every week to get an update. So as I mentioned before, across the country, the testing supplies have been in short supply. So there has not been an allotment sufficient enough for us to do broad testing, and so thus, as I said before, we have had to have targeted testing. So with every facility where there is a COVID case, there's testing going on. For those without, we have an infection control specialist. The prevention of COVID and setting up, particularly in skilled nursing facilities, the infection control procedures, which is what was part of the issue out at Life Care, where we had the biggest outbreak to date, is a matter of making sure the nursing home is following infection control, following the rules that they're supposed to inform public health when they have respiratory diseases occurring in there, and our closer connection with EMS so that if there are calls that are occurring to a nursing home, that's an early warning sign. The $2 million that you mentioned from Gates that was given to public health was not related to testing. That was for critical infrastructure we needed to do the community mitigation strategies, and it will take us through in our work that we're doing both with all of our partners as well as these different sectors over the next number of months. The tests, as I said, in this next week we're expecting an influx of them so that we can start upping testing in critical areas, which are in the long-term care facilities and in the homeless facilities. We will still be restricted for a period of time while the federal government, the state government, and all jurisdictions are trying to find ways to get valid tests in here. There's been a lot of chatter in social media about tests, and not all those tests are actually valid. So we are diligently trying to get testing increasing in King County.
Great, thank you, Patty. That's a very complete answer. Let me, we've got a lot more questions, but I want to introduce Ingrid Ulrey, your colleague, Director Hayes. Ingrid is the Policy Director for Public Health for Seattle-King County. Ingrid, you want to say a few words, and then we'll go back to the phone lines? Thank you for your patience on this call.
And I'll be dropping off now, Doug, so thanks so much.
Okay, thanks so much for your time. Ingrid?
Hi, Doug. Thank you so much. I really appreciate AARP hosting on this call, and hello to everyone listening. I would echo so much of what people have already heard from Mayor Durkan, from Patty Hayes, and from Cathy Knight. I guess I really appreciate the last caller calling out the very troubling and tragic impact of this pandemic on individuals living in long-term care facilities. We've talked over and over that the highest risk individuals for COVID-19 are people over the age of 60 and with underlying health conditions. If you put on top of that the need for assistance with activities of daily living like dressing, transferring, eating, individuals who have those needs, many, as Cathy Knight mentioned, are living in the community with the support of family caregivers and paid home care workers, and many are living in more institutional settings. So if you combine the high risk of the age and the underlying conditions with living in a close congregate setting where you're sharing space with many other people and interfacing with staff and other residents, the risk levels just accelerate, which I think explains why we've seen the most heartbreaking outbreaks of COVID-19 in our skilled nursing facilities, in assisted livings, and now creeping up in adult family homes. We're paying really close attention to these outbreaks. We have 76 long-term care facilities just in King County who have had some level of outbreak, one case or more or many. What we're doing about that is sending in, there's two major interventions. I just mentioned three things, and then I'll take it for questions. One is the infection control teams. These are teams of nurses and other professionals trained in infection control who go in personally and into these facilities and guide them on changing behaviors to most strictly as possible prevent the spread of the virus through hand washing, through changes in ways that gowns and gloves are handled, through changes in ways of just simple things like not passing a pen and having everyone use the same pen when they fill out a form. Infection control will save lives, and the teams who are doing that, both from my agency, Public Health, as well as the Department of Social and Health Services at the state, are really critical and are getting out to as many facilities as possible. It's also important to do this for facilities who don't yet have a case to stop fires from beginning. Testing, we've talked a lot about, is the other major important intervention in affected facilities. People have to have understanding and awareness, not only of the residents who may be COVID positive, but also of the workers, and ensuring that we don't have workers coming in further spreading the disease not only between the residents of one facility, but between different facilities they may also work in. And finally, the third point is support for the families. It's heartbreaking to think of not being able to visit your mother or father or loved one in a nursing home. Support for the families who have fear for their families living in a skilled nursing home or assisted living or other need to get support. We have a program now available through the State Department of Social and Human Services, putting social workers in some of the most effective facilities to support the facility administrators in communicating with families and helping them have touch with their loved ones that's not in physical touch. And we also have the important State Long-Term Care Ombudsman program, and their whole role is to protect the rights of nursing home residents and the rights of their families. So I just really wanted to call that out. Of the 241 people who have, as of today, who have died in King County, 157 of them, or nearly 65%, have been individuals living in nursing homes, assisted living, and adult family home, and our hearts go out to them. Thank you, Doug.
Thank you, Ingrid. If you're just joining us, that's Ingrid Ulrey, the Policy Director for Seattle-King County Public Health. We also have Cathy Knight, the Division Director of Aging and Disability Services for the City of Seattle. And earlier we had Patty Hayes, who is the Director of King County Public Health, and Mayor Jenny Durkan. Let's go back to the phones. We still have quite a few people on hold. Sherry, you have a question?
I do, thank you. Are we required to wear masks when we go out? And if so, where can I get one? Because I don't sew and I don't have materials to make one.
I had that same question over the last couple of days. Any thoughts on that, Ingrid or Cathy?
Masks are important, but they aren't as important as the social distancing of staying 6 feet away from another person, as well as the personal hygiene around hand washing and caution when coughing or sneezing. As has been mentioned already in this call, we have an unprecedented shortage nationally of what's known as protective personal equipment, and masks are a key part of that. There are different kinds of masks. There's something known as an N95 mask that is critical for those frontline healthcare providers working in the hospital settings and in the ICUs to protect them from not getting COVID-19. Huge shortage on the N95 masks. There are also lower-level types of masks, including surgical masks and just simple cloth masks that people can make themselves. For all the masks, rule number one is we want to reserve them first and foremost for our healthcare providers and first responders. However, individuals can also access masks either through the many people in the community who are actually sewing and making them, or if you don't have the bandwidth to sew, which I don't know how to sew, you can simply use a bandana or other cloth to protect your face and nose when you go out into the community or the grocery store. But that's the word on masks. Important, yes, but not as important as staying home and avoiding being in close contact with other individuals and staying at least 6 feet away from other people.
Okay. Let's go to the phones. Leonie. Are you there?
Yes,
Leonie?
I am.
Go ahead.
I don't have a question. I do have an observation, and I invite your comment. Since this is a novel virus and we don't know its behavior, could you respond to the fact that it's an unknown behavior, we do not know the long-range health effects, and it seems reasonable because it is so unknown that we should comply with a request to isolate ourselves and to take precautions?
Thank you, Leonie. We couldn't agree more. We think it's a critical time to adhere to the guidance from the governor and from our local health officer, Dr. Jeff Duchin, to stay home so we can stay healthy. So that does, staying home is just another way of saying to self-quarantine, essentially, which is extra important for anyone who is experiencing COVID-19-like symptoms. And isolation is critical for anyone who is experiencing symptoms or who is actually tested positive. Some people don't have the ability to safely self-isolate or self-quarantine, which is why the county, along with in conjunction with the City of Seattle, have set up isolation and quarantine recovery centers for people who are homeless or other individuals. For example, someone who works in a grocery store and lives with an aging parent and is very afraid and scared of exposing their aging parent. We need to be creative. We need to find a way to keep people safely self-quarantined or at home and not in close contact with others, especially high-risk individuals, including older adults.
Great. Thank you, Ingrid, for that answer. Let's go to the phones again. Marlene, do you have a question or a comment? Marlene? Are you there?
Yes, sorry. I apologize here. I didn't realize this is how you took it. Thank you. We're looking at wondering whether or not taking Sunday drives are a possibility. We have children that are very concerned that we should not leave our home at all. And the last couple of Sundays we did take drives. My husband has a convertible. We've also had the top down. We're hearing about the aerosol in the air going up to 26 feet. And we're talking about short drives, or whether you could actually go on the freeway and go for a drive to like Whidbey Island and come home in the same day, but never leaving your car, and wondered whether that is an even practical thing to do at all. And we're seeing varied opinions about this from different research on the internet, in the same way we see varied opinions about whether you should wash your groceries or not from doctors, and would like some help in discerning this, including even short drives.
Thank you for that question. That's a very common question in our queue here. Anyone want to take a crack at that?
I'd be happy to, Doug. Hi, it's Ingrid from Public Health. I think an important thing to do is to embrace the things we can do safely. This is a really hard time. I think people are feeling isolated, bored, lack of sense of purpose. I think just as humans, we have to be creative about finding new ways to feed ourselves, not just in terms of sustenance, but in terms of activity that keeps us in a healthy mental state. So what I would ask you to do is apply the rules of social distancing to any activity you are considering doing. So, for example, will you be 6 feet apart from any other individual who? And I would note that with spouses and other close family, you may already be exposed, so that you may be less concerned of staying apart for someone you're sharing close space with in a daily life. Will you be washing your hands? Will you be covering your cough or sneeze, etc.? So in terms of taking a drive with your spouse, I think the most important thing would be to drive carefully, as it would be in any time, regardless of the outbreak. However, we are hearing some reports from law enforcement that there have been some a higher proportion of unsafe drivers on the road. But what I would recommend in terms of taking a Sunday drive, which seems like a good activity to me, is one is if you're in the car, that's a closed space. So know that being in close contact with more than 2 people in the car with someone who you aren't already exposed to could be a risk. However, doing the drive with your spouse and driving carefully, keeping the windows cracked to have good air circulation, would be in what I would, if you apply the principles of how to stay safe, would be a good activity, as would taking a walk outside. Outside, I would just caution people to avoid crowded places where it really isn't possible to keep up that 6 feet of social distance.
Thank you, Ingrid. That's Ingrid Ulrey from King County Public Health. I think we have time for one more question, and then we're going to wrap up. We're approaching the end of the hour. Let's go to Anya. Are you there, Anya?
Yes, I am. It's more of a comment, but I would like a response. In all the policy from the different levels of government, it does not match my situation where I have no one to rely on except myself, and I have to use public transportation, unfortunately, to go out to the stores. I could easily stay home 8 to 10 days, but when I go out shopping, they're constantly out of things, and not just toilet paper. And I find myself having to go out at least every other day. And I'm catching a lot of exposure being on the buses. And it's very annoying. So I haven't heard that reality, and I know a lot of people in the same situation. I have not heard that reality addressed at the city level, the county level, nor the state level. Thank you for taking my call.
Yeah, so this is partly for people who rely on public transportation. How assured are we that that's a safe endeavor, and for people who don't have support for others to shop for them? That's a tough one, huh?
Doug, this is Cathy. I'd love to take a shot
Sure.
answering that.
Sure, Cathy. Yeah,
okay. First of all, I'm not sure if the caller lives in King County, but if so, I'm going to remind them about the toll-free number for Community Living Connections, which is 844-348-5464. And these are exactly the kinds of situations that callers have these days, and we are looking at all kinds of different options, being as innovative as we can be to address these needs. Some of it can be grocery delivery for folks. It can be using alternative forms of transportation. We're lucky that we've received additional federal dollars in response to the COVID crisis that gives us a little more flexibility with some of our funding. So I would encourage you to give Community Living Connections a call.
Excellent. Do you have anything to add to that, Ingrid?
No, I thought that's a great answer, Cathy. Thank you. And I think there's special concern of people who live alone. I think this is this is very challenging in this environment. And I think the wise rules that you're already following, Anya, of going out as little as possible, and then thinking creatively about how you protect your exposure while on public transit. And I know our Metro department here in King County is taking some measures in that direction. And I will just note the feedback to them of just continued public concern about is there anything more we can do to reduce close contact in public transit. So thanks for raising it.
That's great. Well, we're reaching the end of our call, and I really want to thank our guests, Mayor Jenny Durkan, King County Public Health Director Patty Hayes, Cathy Knight, who's the Division Director of Aging and Disability Services for the City of Seattle, and Ingrid Ulrey, who is the Policy Director for King County Public Health. This has been a very informative discussion, so our thanks to each of you, and thank you to our AARP members, volunteers, and listeners for participating in this discussion today. In the face of this crisis, AARP is providing information and resources to help older people and those caring for them protect themselves from the virus and prevent it spreading to others. All of the resources referenced today, including the number that Cathy just gave you for Community Connections, can be found on our website at aarp.org/WA. Again, that's aarp.org/WA. There you'll find the latest updates on coronavirus as well as information tailored for older adults and family caregivers.